Okay, the Public Building Commission meeting will now come to order. And Donna, please note we have all three members present. And any changes to the agenda? Okay, approval of prior minutes. Did you, commissioners, read the minutes? Any changes? Or
I had none.
No issues, yep.
minutes will stand as submitted. Consideration of accounts payable. What?
No bills.
Since we
No
didn't have any
bills.
bills, I didn't
Okay.
think.
So there's no bills, okay. The 2019 PBC audit.
The audit is still being worked on by Adams, Brown, Barron, and Ball. They were waiting on one department to give them back their information to be able to push back both the county audit and the PBC audit. So
Okay,
hopefully the first part of August we'll have those answers, or the audit completed for us, and then they'll come down and present it to the commission like previous years.
okay. The project manager report.
I guess I will clarify that with the audit. They will probably, even though we won't have a PBC meeting in August, because we only do them quarterly, they'll still update us when they do the county audit as well. Project manager report, just with all the different projects that are going on. Not all of them are specific to the PBC, but the last one that we had going there was the restroom projects. And I think it kind of worked out very well in the courthouse. Maybe one of the good things from COVID is the courthouse was basically shut down there at the beginning of March and into April. That allowed the workers to get in there, get the job done quicker, and not have to disrupt or make any noise during the court sessions. That project did get complete, and we did make final payment on that. So other than that, the PVC project should be complete until, or if we decide to do anything more.
How is the elevator project coming?
The elevator is in pieces in the garage.
Okay,
The new one, and so it's been shipped, and I mean in pieces because the installation company was waiting to get here because of where they were traveling from. We didn't want them in and out of the law enforcement center and the jail, and bringing the transmission of anything in for that population. So we were hoping in August to get started, and I had asked Greg Herbert to get a hold of Commercial Builders, which is the general contractor on the project, to come down and do an inventory and inspection of all the equipment and parts to make sure, while we are still waiting to ensure that we have all the parts before we get started, and then be missing something and then the project be put on hold again and then have a complete elevator system out of service. So still waiting on that.
okay.
There's other projects within the county, but not necessarily with the PBC, that we're still working on.
Okay, and there's no executive sessions? So the Public Building Commission meeting will now be adjourned. Okay, the Board of Ellis County Commission meeting will now come to order. Let's all stand for the Pledge of Allegiance. I pledge allegiance
To the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Donna, if you could call the roll.
Commissioner Dean Hazelhorse,
Present.
Commission Chair Bud Schleier,
Present.
Commissioner Dustin Roth.
Present.
You have a quorum present.
Any changes to the order of business?
One executive session, Mr. Chairman.
Okay, one executive session. We didn't have any prior minutes. I need a motion for the consent agenda.
I'll make a motion to approve the consent agenda, items A through G.
I second that.
We have a motion and a second. All in favor say aye.
Aye.
Motion passes 3-0. Monthly financial report. Is there any questions, concerns about the monthly financial report?
I had none, Mr. Chairman.
Okay, COVID update. Jason?
Good evening, Commissioners. Jason Kennedy, Ellis County Health Services Director. Tonight it's not exactly the great news that we're all looking for. As you see from the press release that I put out this afternoon, we have seen cases increase in Ellis County. This was not We expected this. Following the 4th of July weekend, we expected it. You see cases across the country increasing. You see cases in the state of Kansas increasing. County by county, you see cases increasing. This is something that we expected. As you see, we have 18 active cases. There's been some question about why total cases would go up without active cases going up, and a lot of that is because people are putting off testing. The symptoms are so mild or really not recognizable, so they'll put off testing until they're actually at the point that they're recovered or out of that window. So they actually go in as a total case. All cases are counted, but they might not be an active case. We also have people recovering. We have people that recover, so we have kind of a balance of both. The recovered cases, they, just like the press release says, recovered cases are people that have recovered. They're no longer contagious to the population. They're no longer infected. They are no longer able to spread the virus. Therefore, they're able to go back to their normal day-to-day operations as long as we're maintaining that social distancing piece, which is extremely important. Now, we have seen an increase of 30 cases since Monday the 6th. As we look at those numbers, probably the one thing that I didn't expect with this is how many of them would be associated with clusters. So we've talked about this virus and its ability to transmit person to person. Really, its only primary means of transmission is person to person. Anytime you gather in groups, you bring together big groups of people, you have a likelihood of being around someone who has COVID. As you see, of our 30 cases in a week, 23 of them have been associated with 4 clusters. One cluster from the I-70 truck stop outside of Topeka, which is amazing that case would travel all the way here. However, that case turned into 2 and possibly 3 other cases because they came to stay with family and were in the same home, contracted it believed to be there. Don't travel. If you don't want to go get COVID and bring it back to Ellis County, don't travel. The second cluster, or 2 of the other clusters, are both gatherings, private gatherings. On the 4th of July, it was to be expected. People gathered in groups. As you gather in groups, again, you increase your chances of contracting COVID. The more social distancing, the less chances you take. The fourth one was actually a small cluster associated with a long-term care facility. That facility actually put out a press release today. We don't generally, as a general habit, and following KDHE policy, we don't blast out to everybody if there's something in a facility that is contained, something that doesn't impact the general population of Ellis County. We've kind of confused through this our right to know and our want to know. And so everybody wants to know, but that doesn't necessarily mean that information impacts their life. If they are impacted by a case in Ellis County, they will be notified by our office. They will be mandated to isolate, quarantine, test, whatever we do with that situation. Anyone that is impacted by a case will be identified through contact tracing and notified by our office. That long-term care facility, we within 3 days had recognized that we had a positive inside the long-term care facility. Within 4 days of that recognition, every single member of the staff in that long-term care facility and every single resident in that long-term care facility was tested. Test results were sent to KDHE labs. Test results came back. Thankfully, no residents have been impacted, which means that the viral transmission practices that they're utilizing inside that facility are working. That's a good thing. We want to keep it that way. Now, with that, we actually they initiated a second round of testing as of today. So within 4 days and then 7 days later, we've tested the entire facility again, including residents and staff, so that we're making sure that we're capturing that entire latency period of that virus and making sure that we're doing everything we can to keep it out of long-term cares. Now, those are the clusters we have in Ellis County. If we look statewide, we see similar trends. Clusters are what creates viral transmission because viruses transmit person to person. In the state of Kansas, 6,873 cases, 34% of all cases in the state of Kansas have come from clusters. 469 hospitalizations, 35% of hospitalizations have been out of clusters. 216 deaths, 75% of the death toll in the state of Kansas has come out of clusters. 58% of that from long-term care facilities. In Ellis County, 52% of our current cases come out of clusters. don't gather in groups. As we look at our numbers, the rest of our metrics and the rest of our numbers, our case counts, our active case counts are a little low to really project where we think we will go or where we will see this go. Obviously, the 4th of July is making a fairly significant impact on our case counts right now. How that goes for the next 7 days, we'll have to see. Testing has also increased. We see our percent of positive, which has been around 1 to 2% historically through this. Our percent of positive, our 7-day rolling average for percent of positive, has increased to 8%. That's still underneath the state's percent of positive of 8.7%. We want to see that number low. What that number means is that the number of cases that are returned positive from your total tests is less. That means less community spread. Now, we are just absolutely fearful of the word community spread. Everybody wants to know, is it community spread? Yes, it is. Has been from day one. If you don't have an origin or a source outside of your county, outside of your town, outside of an individual, you have it in your community. We have it in ours. Now, what do we do about that? Socially distance, you wash your hands, you don't touch your eyes, nose, or mouth, and you avoid contact with people because COVID spreads person to person. As we look at other mitigation measures, masks, what a topic. So I think you'll see most public health directors in the state either adamantly or vehemently try to hit one point. Everyone with masks on, everybody. So we made a choice, you guys made a choice with a recommendation from me a week ago. That choice was to make a non-enforceable mandate based on little evidence that they work as a community mitigation tool widespread for everybody. In an uninfected population, we have 18 total cases, 18 active cases in a population of 28,000 people. So, we have a fairly uninfected population base. Now, do masks work? In situations, absolutely. High population density and high viral load. Long-term care facilities, indoor spaces, at your mass gatherings that you shouldn't be having anyways, inside your home. If we made a mandate for masks, that mandate should say, anytime you have an infected person inside your home, that infected person should wear a mask. Now, how do we mandate something inside a private home? How do we enforce something inside a private home? So, what people need to know is that it's in our community. It's not going away. We will not see this go away. We're not gonna pick a date in the future and it's gonna be gone. Vaccination is the only way to really get rid of a virus. So, until then, we have to make smart, safe choices that allow us to move forward. We have to avoid mass gatherings. We have to implement masks where they're appropriate or where they make sense for your business, your organization, your entity. We have to wash our hands, and we have to continue to move forward with life as we protect ourselves and those around us. If you care for others, if you care for elderly, you care for the at-risk, you work in long-term care, you work in healthcare, don't travel. Don't go to parties. Don't attend mass gatherings. Keep yourself safe. Keep the others around you safe. Masks are sensible for your organization, for your business. They help with mitigation inside your business. Absolutely. How we treat long-term care facilities, how we implement measures inside of long-term care facilities will be different throughout the duration of this entire pandemic. 58% of the state's death toll comes out of long-term care facilities. As we move forward with this, what I want the public to hear from me is that I will not issue orders, or I will not recommend. I don't issue orders, you guys do. But I will not recommend orders that are based on political decisions. I want them to trust in me that I'm making orders based on the data and the facts and what we have in front of us. That way, when I do need an order, when I do need to issue something, or I do need to make a recommendation to the County Board of Health, that we make a decision for the public, they will listen and they will follow through with it, because this isn't ending anytime soon. And so if we need that order, I don't want them to say, oh, they did it one time and it didn't work. I want them to know that when we're there, they'll hear it from me, they'll believe it, and they'll follow. And right now, what that recommendation and what that order is to avoid mass gatherings, wash your hands, and don't touch your eyes, nose, or mouth. Other than that, you make the decision to protect yourself, your business, those around you. You guys have any questions for me?
Yeah, Jason, couple of things here. You mentioned masks are okay in certain situations. And yet, when I turn on the TV at night, they're telling me to wear a mask all the time. Anytime I want to go somewhere, do something, I have to have that mask on. So how do you overcome that? How do I explain to people you don't need a mask all the time when that's all they're hearing?
You know, there is no way we will ever battle what the national news media has to say. They have a voice that I'll never be able to overwhelm. But what I tell people is, if you want to wear a mask all the time. I recommend masks in high dense and high viral load environments. If you're caring for an elderly person inside your home, if you're caring for a loved one who has COVID inside the home, if you're attending any type of indoor event where there's a large number of people, if your business wants to mandate them, if you don't want to put one on, don't go to that business. If it makes sense for your business, implement it. As far as a widespread community measure, it's never been tested in in a low infection rate, low population dense environment. The numbers we have are mathematical projections that use data from New York City subways to show the effectiveness of masks in a general population. So as we look at that data, we need to make sure that it makes sense for Hayes, and then it makes sense for the residents of Ellis County. And if we need that measure, I want them to believe in us that we've made that measure based on the data and the facts for Ellis County, not for New York subways.
As I've been accused, and probably my fellow commissioners have too, is we're not being proactive enough. We're just not. And so as I think about the situation, I'm expecting infection rate in Ellis County to start soaring, most especially when the college starts to open again and we get students back in town that are going to do what students do. They're going to have their gatherings. They're not going to social distance. And we also got a fair coming up, although it's going to be somewhere as an outdoors fair, but it's still a fair. You'll have a Labor Day holiday with mass gatherings again. I haven't heard yet on what is planned for Oktoberfest. So I don't know what happens there, but I do know previously with Oktoberfest, the parties associated with that could contribute greatly to a virus issue. So are you encouraged by what the community's doing to try to prevent infections? Because I think they're going to soar. This thing's going to go up like a rocket in probably about a month.
We will see infections continue to rise. Hopefully it is at a mitigated pace or a slower doubling rate. And as of recently, we've had low hospitalizations from this, especially really even across the state, and we've had a fairly low death toll from the actual virus. So as far as what the community is doing, I think they're taking the appropriate steps right now as they are presented from KDHE and CDC. I think you see a lot of businesses around town, even with our recommendation, every one of my press releases says if you can't socially distance, wear a mask. Mm-hmm. If you can't socially distance, don't go. If you want to go, understand that there's a risk associated with that activity and protect those around you when you return. So, I think the community is doing its part right now with our current infection rates. I think that they are educating. They're providing hand washing stations. They have implemented social distancing as much as possible. I think you see a reduction in what the fair is doing. I think you've seen a reduction in what a lot of the individual businesses are doing. However, sports were a huge concern as far as all these kids coming to town. We've seen no spread, no clusters, nothing associated with sporting tournaments as far as outside. Now, there was the MAYB tournament. Again, that was a cluster outside of our county. We actually saw no positives following that cluster at the MAYB tournament. So there are certain events that carry less risk than others, and those are those events that are outdoors, have more open space, good air exchange, all of those types of things. But at some point, you have to make a personal determination on what your risk level and what your risk acceptance is. There cannot be a measure to protect everybody universally. Everyone has to take steps to protect themselves individually. Do that risk assessment, make sure you're risk aware, and make sure you take those appropriate steps, including socially distancing, washing your hands, not touching your eyes, nose, or mouth. And the KDHE and the CDC, they recommend, as well as the County Board of Health recommends, and as well as I recommend in every single press release, if you cannot maintain social distancing, wear a mask.
Even if this Board of Commissioners was to invoke the governor's executive order and mandate masks, that still wouldn't stop the college parties. You can't drink beer with a mask on.
It's that goes into the political realm of mask mandates. I thankfully that's the one part of this whole thing I don't have to be a part of.
Mm-hmm. Dean, any questions for Jason?
I think he's doing a fine job. Keep up the good work. I appreciate what you're doing. Your thought on the COVID-19, what to do, not what to do. I think we have enough of the political part of it in Ellis County the way it is. That weighs in on it, as you know. So, well, I think you're doing a great job. Keep it up.
Dustin, any comments?
Just a couple questions, Jason. First of all, like I said, like he said, amazing job. I imagine you weren't expecting this when we hired you a few months ago.
Anybody was.
Yeah. One thing on the contact tracing, I've had a lot of people say how quickly you guys are getting on top of that, which I think is largely important to our ability to stop the community spread and quarantine people. We're going to talk in a little bit about Spark money and our ability to help make sure that we've got the proper amount of contact tracers and all that. I know you've trained quite a few of them, but what's your thoughts if we were able to get some funding to be able to help you in any way in that contact tracing to speed it up or at least be on top of it as good as you have been if we see spikes like this, when we see spikes? Is there anything that we can do from our perspective?
So I think yes, and I think we'll actually maybe talk about that with JD and I had a conversation segueing into the next topic over some of the hiring of new personnel. But yeah, I do think there are some improvements that we can look at as far as adding personnel for the contact tracing. I will say that the health department staff has been phenomenal. Every single one of them has stepped into a new role that none of them were expecting either. We have completed all contact tracing. As of to date, all contact tracing has been completed in the first 24 hours. Now, I know there's a lot of people that have said, well, I didn't get called. It's because you weren't determined to be a contact. Mm-hmm. That's why you didn't get called. So now we only have one side of the information. That is the one issue. Well, there's plenty of issues with contact tracing, but the issue that we run into is we only have one side of the information. So if you forgot you were by John Smith doesn't get listed as contact, which is why everybody needs to take universal precautions. And if you find out or you think you've been next to a positive in their infectious period, quarantine yourself for 14 days. I don't have to do it. You can do it. Mm-hmm. Stay away from people. Quarantine means you just avoid contact with all people. So do that. If you think you've been a contact, if you think you've contracted COVID, if you have symptoms of COVID, isolate yourself immediately, call your primary care physician, and get in and get tested. But just know that the minute you get tested, you need to remain in isolation indefinitely until your test results come back. As we see more asymptomatic testing, as we see more symptomatic testing, labs are going to get to where their turnaround time is less. We already see it nationwide. If you test, even if you're just curious, or if you're scared, or if you think you had it, stay in isolation or quarantine until you get your test results. That way you haven't impacted anybody else. So we have a couple of issues there with quarantine and isolation. One of them is people not adhering to it. If you're in quarantine, adhere to it. If you're in isolation, adhere to it. And if you've been tested, isolate yourself until you get your results returned. And so with contact tracing, it takes a ton of time. It's an hour and a half at minimum for each identified positive. That's just to get through the initial interview, get through all of the information for KDHE, all the input variables, and then find out all the people. Then from there, we actually start calling the contacts. We start calling people to make sure that they know that they have been a contact. So it does take a ton of time. And what we have stopped doing in the office is preventative measures, or pushed off as some of the preventative measures and the other functions of the public health department that have to come back online to keep the population safe. COVID is not the only thing in our community. There are plenty of other things that are going to continue to spread. We've got to vaccinate kids for school. We've got to vaccinate kids for flu. We've got the WIC program. We've got everything else that we currently do in our office to make sure that the community is safe, and those are the things that we've got to get back online, and that's what we need additional staff to help with.
So I'm encouraged a little bit by the aspect that a lot of your contact tracing and positive testing is, you said, mildly symptomatic, almost where a lot of them don't even know that they've contracted. And so just speak to that a little bit. You mean these people just don't really have an idea? You call them, you say you need to get tested, and you need to stay away from people now.
Sure. Yeah, a lot of people have extremely mild symptoms, and that makes it somewhat difficult to identify early on, because people, we're generally conservative with healthcare, especially out here. It's, nobody really wants to go to the doctor. So a lot of the symptoms are pretty mild. Right now, we just went through harvest. Everyone has allergies during harvest, so there's a lot of that kind of stuff that we have. So people are kind of putting off some of that. And then we also have some of the people that are becoming more ill, and actually, KDHE reported today we had one hospitalization last week per KDHE numbers. We've actually had 3 hospitalizations. I don't know where KDHE gets their numbers because they're not my numbers. My numbers are 3. We have had 3 hospitalizations. One of them was there for a 80-year-old gentleman, was there for another type of event, actually tested positive for COVID. They're all doing really well, but 2 of them actually put off other medical things because they were afraid of COVID. And so we need people to get in and see your doctors. Go do your normal things. Same thing as the health department. We've got to get back to vaccinations, immunizations, all that kind of stuff to make sure that we create a healthy population. A healthy population combats a virus better than anything.
I'm glad you said that, because I've heard numbers of cancer detection way down. Well, we just know that cancer is not gone, and that people are not going in and getting their tests to be able to be sure that they're cancer-free. Same way with heart disease. I mean, heart disease kills way more people than COVID-19 will kill every single year. Well, if you're not going and getting taken care of by your doctor, we're letting this disease beat us in other ways than even just a contraction of the coronavirus. One thing with the masks, and I always want us to be as proactive as we can be. Obviously, this has been the issue that I think has been said, is we're not proactive enough. Well, one thing that I think about masks is that I believe they give you a bit of a false sense of security. And I think that because of that, I think the social distancing has always been what you've been trying to tell people. If you can't social distance, a mask is effective. It's good. It protects other people around you. It protects you somewhat. But also, I think sometimes people throw that mask on and they get feeling a little bit too invincible, and we run into the same problem. That being said, this is more a question for Darren. I know we've been purchasing masks and doing our best to be ready for any kind of spikes. From our perspective, I wonder if in our building, when people can't social distance, that we have available masks. for them to put on, potentially staff. I don't know if we have enough. I know when you're wearing paper masks, you should be switching them out every 4 or 5 hours, I believe is the recommendation. How well are we equipped for that, Darren? And is it something that we could implement for people that are coming into our building to protect our staff?
So a couple parts to that question, or a couple different questions you have there. First, in regards to our county employees, we did make a request. JD and I visited about this about a week or two ago. And we have thousands of masks that we have in reserve that I ordered for through the state for our county employees, not for the general public, as well as cloth masks. So that way, when we start looking at the 3-ply disposable mask, eventually we will run out. So I got enough masks to provide, I believe it was 4 masks for every single employee in the county. So that way we could issue them out. If we get to that point, they could take them and wash them and reuse them. So that way we have a longer supply of. We have plenty of masks that Jason and I have been on top of to keep with like the N95 masks, as well as the disposable masks to help protect our public safety individuals, the health department, EMS, the sheriff, fire, to make sure that those individuals are taken care of. The state resources that we can request are not necessarily to be used just to be given out to the general public. If we get to that point, or if the commission would like to get to that point, we probably need to look at purchasing masks, so that way we can put them at the doors if we want to issue them, or if any individuals want them. And then we also need to worry about the other end of it is when they get rid of their masks, they are disposable. We want to make sure that we provide the proper facilities to throw them away and dispose of them afterwards as well.
Jason, what's best practices in a situation where we decide that we would like people within our buildings for the county to be wearing masks? I'd imagine it's some sort of hand sanitizing before you grab your masks and or bring your own in type of situation. Is that something that you think we could implement? And maybe has staff reached out to you guys, including JD, about the potential for doing such a thing?
So what I'll recommend to you guys is the same thing I recommend to every other business in this town. If you can't implement social distancing and masks make sense for your business, implement them. People need to understand how to put the mask on, take the mask off. That's something that we probably can't educate them on tonight. That's something that they need to access the website, KDHE. We also have a link to it on our website. They can go there and look for that information as far as proper etiquette for placing and removing a mask. Hand washing is extremely important, and then implementing those mitigation measures. So if you're in an instance in your business where you can't implement that social distancing, it's up to you to decide if the masks are the important measure that you need for that event.
What do you think, guys? I came in today to get something worked on by IT to get my email up and running properly. There were quite a few people standing out in our lobby, and does it make sense for our business? I think it might. In terms of I don't know how well they're social distancing when they're standing in line waiting to pay their taxes or sign up, register to vote, those type of things. It's just a thought process from me. I will say that my business is different. I'm not very close to the people I work with. I have a case in between us, and encourage people to wear masks when they want to, and have worn masks in a lot of businesses that I've gone to because they've requested it. So, it's just a thought from me to be a little more proactive with our staff. As long as we have the resources to be able to do it and we're doing it properly, I think it might be something that we should consider as we start seeing cases rise.
I think it's worth consideration. I think before I'd want to make that kind of a rule, though, I'd like to hear from some of the department heads, see what they think. Okay. We got some here tonight. Donna, what do you think of that idea?
Well, what I want to stress, and JD and I had spoke today, is that we're going to start advanced voting next Monday. Okay. We're sending out almost 2,400 advanced ballots on Wednesday. Mm-hmm. So, there's some interest, and that's great to see for voters. But I think we need the accommodations to be able to handle it too. And, you know, advanced voting goes on in our office, so we're going to bring people into the building.
Okay,
I mean, I think a lot of people are come in already wearing masks. If they go to Walmart or Dillon's, I mean, they have a mask.
I see a lot of people wearing
I mean,
masks.
that-
I don't know if it's
I mean, that's
something we
fair
want to
for
say
the
we
last-
have to do,
Right.
but I'm not necessarily opposed to it either. I just, maybe it should be more with every department. I don't know that Bill Ring's department should have to wear masks when most of these guys are out in the county, you know, same.
Absolutely not. Yeah.
You know, some of those guys up at the landfill, if you're confined in an office, that's a whole different thing. So it maybe should fall to the department head to really assess that.
Yeah.
And maybe that's a conversation JD could have with department heads and see where they land on that.
I think that would be great if you all would like for me to do that. I'll visit with the department directors and we'll bring that back to you next Monday. And
Sure.
Because you're exactly right. Not everything the same rule apply to everyone in their different situations. Also, you have different areas within some county facilities. Some it's just staff, and then you have other areas where they're very public and open. And we should probably protect the public as much as the public protects the staff. So in those areas, maybe it does make sense. And especially as Donna said, we're getting into election season. It will follow right after the fair. And so this maybe is a kind of a critical time for us, especially maybe during the election, and then maybe we assess again after that. As Jason said a moment ago, our numbers are still very low. But also, you know, driving through town on Vine Street, you see all sorts of out-of-county, out-of-state plates. So we have opportunities for that to come from outside as well. So I'd be happy to do that.
Sure.
Bill, legally, with the other elected officials, I always never want to step on any toes without any mandate, and I don't think that we feel like there should be a mandate in the building anyway, but at least maybe a sign that says, all the recommendations Jason's always given is stay away from each other. If you can't,
Travel.
please wear a mask, you know, those type of things. And if the masks are available, I think the public will know the need is there and will be protecting themselves as well as protecting the people around them. I don't think anybody is anti-humanity in this. I think we all want to help each other. It's just a matter of how we go about it. And maybe this is a little opportunity for us to lead by example. Without the strong arm of government, to say we think this is a good idea and we'd like for you to wear a mask if you can't social distance in our buildings.
And I think too, fellow commissioners, as we see the infection rate go up, and it will go up, we're going to have more pressure on us to mandate, have a mask mandate. That we need to be aware of that because it's going to come at us. And we need to consider it. So,
I agree. I think that's something that we all three need to weigh on is at what point and at what danger level are we willing to start any kind of draconian measures.
Sure.
And JD and I have had that discussion a few times is the plan. And frankly, right now, I yield to Jason because I trust Jason, and I think Jason is probably one of the best health directors in the state of Kansas. So he says all the right things. If you don't hear him, it's not his fault. He is telling you how to keep yourself safe, but he can't be at your 4th of July parties and use a yardstick to make sure that you guys are staying 6 feet apart. He has to end up dealing with the consequences of actions, and he does a heck of a job at it. So I will continue to yield to him, but I think at some point we should have the discussion with him about at what rate and where we think we should start discussing any kind of draconian measures.
sure.
I've watched those from day one.
Yeah.
The public will know, you guys will know,
Okay.
when we reach a threshold that we need to implement these measures. Right now, the worst thing we can do is have a fearful public. The worst thing I can do is have a fearful public. Because once you become fearful, you no longer educate and you no longer listen.
Exactly.
We need people to educate themselves. Right now, we have a 8% positive, which is less than the state average. We have 5% hospitalization rate, which is less than the state average. We have 2 cases per 1,000. We view this as a only cases game. We only care about cases now. We are the 20th largest county in the state out of 105. We are at the low end of cases per 1,000 right now. The state average is 6.88 cases per 1,000. The reason why that's important is because viruses are a product of population density. The more people you have in less space, the more cases and the more spread you'll have. So, we don't need the public fearful. I need them educated, and I need them to listen. And so the measures we take are aimed at that.
And I agree 100% with Jason on the fact that when we have to do this, I want people to know that we mean it and that it's not just being done for any reason other than their absolute protection. And so I believe that was the point that we tried to make when we decided not to enforce the mandate from the governor, was that we didn't want to lose the trust of the public because we weren't at an at-risk rate that met a threshold where we felt like draconian measures were needed. That couldn't happen, and I imagine with all the college kids coming back and the social distancing aspect being lost, we'll see it at some point. But I really appreciate, Jason, you being on top of it, and I don't know about you guys, but I probably have a phone call every other day with Jason just to see how things are going. I probably take up his time, so I'll just stop that because you're doing more important things than talking to a commissioner. But it is something that I do want to keep my mind on, and as always, I don't want us to ever seem like we're anti-humanity. I believe that was one of the op-eds that the news decided to run. So. Thank you for everything you've done, and thank you to the community leaders who have made decisions to cancel your big public gatherings, even as hard as it was. We always want to be supportive of these decisions. Some will need to do it. Some will have to do it financially. But as long as we can be as supportive as we can, I think namely the ACE auction, or as they start talking about Oktoberfest, as you alluded to, we need to be as helpful with them, and the knowledge is there. Jason has given it out. He spent an entire hour teaching everybody the other morning before we had our meeting. So he's putting in the legwork. The public just has to take the time to learn.
Absolutely. Okay. Any questions, Dean?
Jason's doing a fine job. Keep it up.
Okay, we'll move on then to the open position.
Lead off. So I believe this was put on here, and I'll let JD speak to it about changing kind of the way we do this. But I have another vacancy. Actually, I was notified of another vacancy in EMS. As you guys know, we're at minimum staffing every day. We got to replace those positions. So I'm not only asking for or requesting to replace that position upon them leaving, but we are at a point with this pandemic and with me being in two organizations that it is no longer feasible for me to do both jobs in their entirety. I would like to, we need to utilize the grant funding money to place at least 2 more positions at the health department strictly for pandemic response, contact tracing, follow-up, epidemiology investigation, and data entry into the EPI system, all of the state required stuff, as well as doing the contact tracing and follow-up. That'll allow me to prioritize the nurses that we do have back to the roles, the primary functions of the health department, as far as all the other processes, especially coming up into flu season and everything else, getting back to school. I just don't see this as a feasible option without adding some temporary staff. Those 2 staff positions will be temporary. Funding would come from grant funding, and we would look at doing, and JD and I have kind of talked, and I apologize for not having a formal proposal for you guys tonight, but this is, the pandemic comes fast, and next week's going to be a whole different ballgame. So as we look at that, they would be contractual-based positions that would probably be on like short-term contracts, maybe like a 3-month contract, something like that, so that if things get better and we don't need them, we can those contracts end, or they can re-up the contract or whatever. So I'd like to look at adding at least 2 positions over there as far as a contractual basis, and then look at adding a interim assistant director to EMS. We have a great EMS service, and I have great people that work there. Ellis County EMS is top-notch. We've talked about that. The community desires it. I have not been able to do what I need to do to give them the tools and resources to continue. They need someone there 8 to 5 that can prioritize that organization. It's just too big to have that position vacant. So that would be another temporary position, because I don't like making knee-jerk reactions for long-term solutions. And so this would be another temporary position. I'm actually looking at maybe promoting one of our current employees that knows the system, knows a lot of what we already do there, promote them into an interim assistant director position, replace their position on shift with a full-time individual. And with turnover, we'll have plenty of opportunities, even with this end of this year with retirements, or the beginning of next year with more retirements. If we get to a point where we can move that position back out, we could do it through attrition or something like that, with moving them back to shift. It would increase our number by 1 over what we currently have, but it will put us back at what we had start of the year prior to the pandemic. I would like to, and I guess tonight I would just like to ask for your guys' support for me to work with JD on coming up with a plan that works, utilizing that grant funding to allow us to get this ball rolling. We need to get applications out. We need to get the position defined. We need to get all of that done. And so if you guys are on board with a plan like that, utilizing that grant funding, JD and I can work and get that moving, and then we could have a formal proposal for you at the next meeting.
Well, I think with the grant funding, we should first and foremost look at what Ellis County government needs. And you definitely need those positions for the pandemic. And so I'm on board with it. But what you need there, we should supply out of that grant funding.
Yep, get it done.
Yeah, Jason, as far as our budget goes, I think if you can get that interim director done, it would just need to be probably addressed right at that January 1 again. I imagine you guys can discuss that since we've kind of finished up that budgeting cycle, but definitely utilize these funds. I think that the idea of some contractual help at the health department during this, I think, is very smart, and what that money is designed and needed for.
And you guys did set aside, within my current budget, last year, actually, you guys did set aside about $140,000 that was in the CIP funds for an assistant position. We chose not to fill it because of budgetary concerns and because I didn't want to have an unfunded full-time position.
Right.
So we do have some funds there if there is some overage after to work out of that plan, but it's I think right now I appreciate you guys' support moving forward with that. I'll work with JD and see if we can get a formal plan and get the ball rolling on with that.
Perfect. As always, these things are time sensitive. I have no problem coming in here and making sure that you can get that done and get people hired and doing the things they need to do. The virus isn't going to wait for Monday meetings.
Unfortunately, it's not.
Yeah.
Okay.
Thanks, guys.
Thanks, Jason.
Thanks, Jason.
And I think there's another part of this, JD, where
sir.
Now that we have you on board, do we want department heads to bring requests for positions before the board, or just discuss those with JD as they used to do with Phil?
I think we've put our budget out, what they know what they're going to be looking at next year. I don't think we need to do this anymore. I think they understand where they're going to be at. And, frankly, with the elected officials, I think if they overhire because of this year and have to let somebody go, I just hope I think that all of our elected officials would at least think about the people they're hiring and what the potential is for next year. I don't think they need to come back to us. I think it's,
Okay.
especially in situations like Jason's, it's time sensitive, and I'd rather them not have to wait, confer with the guy we pay to do this kind of stuff, and make a determination to get a job offer back out there when we lose people.
Okay, that works for me. Okay.
Thank you, gentlemen.
Yep.
Moving on. We have the Rural Housing Improvement District. Doug.
Good evening. I'm Doug Williams, Executive Director of Grow Hayes. Thank you for giving me a few minutes on your agenda this evening. to talk about something that I believe is much more positive than pandemics. As you may be aware, we started a process for a housing development that started back in the December-January timeframe, where the Heart of America Development Corporation acquired 21 acres, platted into 75 lots at the corner of 22nd and Wheatland. And we had the vision of Grow Hayes working with Heart of America to develop this into a moderate priced home development. And we started this process going through the RHID process, which stands for Rural Housing Incentive District. This is kind of a TIF for housing. I know you've dealt with TIFs before, but this is the first time an RHID has been done in Ellis County. And so we started that process back. It begins with the city, and they do some things, and it goes to the Department of Commerce, and they have to sign off on it. And on June 25th, the City Commission approved an ordinance for the approval and the establishment of this Rural Housing Incentive District. That begins a 30-day veto period for the county and the school district in which they can veto this process. So we're in that process now, and that'll end on July 25th. You don't have to take action unless you want to veto it, and we're certainly hopeful that that would not be the case. We have a significant housing shortage in Ellis County right now, and we believe that this development offers an opportunity to put 20 to 30 homes in the next 12 to 18 months on the market at a price range that is currently not being met in the marketplace, and will enhance the ability for employers to attract employees to the community, allow people to move up the ladder in terms of moving from an existing home into another one, and allow some downsizing for some people to sell their home where they don't need as big a home anymore and acquire something that makes a little bit more sense. All of that bringing more inventory into the market and helping alleviate some real serious shortfalls we have in some price ranges for homes. So I wanted to bring you up to date on where we're at with it. We hope to get it approved on the 25th, that we start at that point. We've engaged an engineer. Driggs Design is working on the survey of it and the stormwater management part, the sanitary sewer, the water, all the things that I had no idea you really had to do in a development like this. It takes time and money to do. But we've started that process, and we hope to have some streets in there sometime this fall where some homes could be started. We're working with contractors. We've talked to 7 of them. I don't think all of them will commit to build homes out here, but we're working with them, and their commitment is going to be to build 4 homes each in the next 18 months. Mm-hmm. So potentially if 7 of them would sign on to that, there would be 28 homes out there in the next 18 months. It's a big financial commitment for a contractor to do that, so I don't think we'll probably have 7 that agree to, but I'm very confident we'll have 4 or 5 that will agree to construct homes out there and get the ball rolling and try and get some things going to where we could have some homes for sale out there in the spring of next year. That's about all I've got to say on that. I would be happy to entertain any questions or thoughts that you all have.
I think it's a good idea. I think we need to go for it.
Okay.
Yeah. Dean, any questions?
No, I think it's a good project also.
Yeah. Dustin?
I got to sit in on the quarterly luncheon where Doug actually talked about the project, talked about housing in general in Ellis County. I have no intention of stopping it. I think, tell me, so this essentially gets these houses in this 175 to 225 new homes with no specials essentially, and this tax, the RHID portion of it helps pay off that infrastructure over that time, correct?
That's correct.
Okay.
The tax that it is now and the tax that it will be once developed, the difference for a period of time goes back to the developer to recoup the cost of the streets and infrastructure.
Okay. And I'd imagine the county is not making much money off of that open field out there behind Hayes Med right now.
I think the taxes right now in those lots, there's about $100 a year, so whatever the county's portion of that would be is certainly not much.
And this is a 20-year incentive?
25.
25-year.
25.
In 25 years, at least we'll be making more than $100 for Ellis County. So, I think it's a great idea. I think you're going to see retirement, a retirement group in there, maybe younger family homes. it really is, I mean, and you know as well as anybody with your time in real estate, but stuff just doesn't stay on the market in that range at all if it's good at all.
We have a
So-
very active market, and the good news, if from the county's perspective, is you have a sales tax going in. I believe it's in September, October,
Right.
and lots of the materials out there that are going to go into these homes will be subject to sales tax. So the county will experience some revenue from that, which will be terrific.
Very good. Yeah, I have no intention of trying to stop this. I think it's a wonderful thing and needed in Hayes.
Yeah, absolutely.
Mr. Chairman?
Yes.
If I could just add a quick point, being new to the community, I also am experiencing exactly what you're talking about, and I believe this certainly is needed, and I think the 25-year TIF program, the benefit on the other side, as Doug was mentioning, also hopefully we'll be able to accommodate more people into the county community and who will be spending money here and increasing the sales tax as well. So I think it's overall a very good benefit to the county.
Very good.
Okay.
Well, thank you for your support.
you,
Appreciate
Doug.
it.
Thank you.
Okay, next we have the CARES Act funding and resolution. JD?
Yes, sir. The last, since I've been here, I've been quickly ramping up on the CARES Act initiative that is underway. As Darren has mentioned before, and I believe you all have addressed, $5.74 million has been earmarked for Ellis County. And I will say that with the transition, me coming on board, probably it would have been nice if we would have had this before you a little bit earlier than now, but we're still okay. I did talk to the state. Hopefully we'll approve this tonight. We'll go ahead and get it submitted probably before I go home tonight, so it will be on record with the state. Very quickly after that, I believe I've chatted with you all. I'd like to do what several of the other counties that I've been in contact with and put together a think tank of folks in the community to assist us with determining the best ways in which we can expend that $5.7 million. And as you said, Mr. Chairman, a moment ago, we want to absolutely make sure that the needs to deal with this crisis at the county level are first fulfilled, and then whatever else we can do to help the greater community, then we would take that into consideration. But there's all sorts of different perspectives that can be taken under consideration. The challenge on this, though, is there's a very short turnaround. We have until August 15th to get a program put together and submitted to the state. So we don't have time to do lots of town halls and that kind of a thing. So I think doing the think tank seems to be what all the other counties are doing that are on top of this, and I would suggest that we do the same. But the first two steps are to move forward with these two resolutions, and with that, then I would plan to see if I could, even as quick as this week, get a group together and then report back to you next Monday on how that's going, and we can touch base on how to best go forward at that point.
Sure, just so the group's a good representation of Ellis County.
Yes, sir.
Yeah. Gentlemen, any questions for JD?
Nope, needs to get her started.
Okay, I need a motion.
I move to approve Resolution 20-09 to receive CARES Act funding and Resolution 20-10 to establish a special revenue fund to deposit and track the funding.
Second.
We have a motion and a second. All in favor say aye.
Aye.
Motion passes 3-0.
Thank you, gentlemen.
2021 budget review.
I would like to invite Darren. Darren's been working on this to this point, and I'd like to invite him to lead the discussion, if you would, please.
Good evening, Commission. This is kind of one of our final steps before the 2021 budget is completed. Thank goodness. It has been in a lot better light than the previous years. As you can tell, the sales tax had a big impact in the budget, as well as some different things that we've looked at with health insurance that the Commission is aware of. And as of what your printout shows within your agenda packet, the numbers have been updated since then. As I stated, we were going to have some proposals back for our health insurance to be able to go back and be able to get a balanced budget with any other final tweaks that we had to make within the budget, either from your direction. As you can see, that was in your your agenda from the reallocation of a position, and so a couple other just small little tweaks, but those updated numbers, and I believe JD handed out an updated agenda item for you.
Yes, sir.
It shows that we do now, with every final step that we had, that the commission had requested that we update, we do now have a balanced budget with a whopping $6254 as a surplus. So it's the first time that I can see back into our CIC accounting system that we actually started the year off with a balanced budget. So that's excellent news, I guess. And I just thought I would stop there in regards to the budget itself. If there's any questions on any of the changes that we've made or anything else that the commission would like to be changed.
Darren, do you want to talk about the health insurance? We got that news back this week, too.
Correct, yep. If there are no questions on the previous changes, we can give you a brief little update. We'll have a more detailed handout, and if the commission so chooses, Julie Yarmer with FCMI will come up and give a presentation to the commission on Monday of next week. The health insurance rates are plugged into the budget, and we were able to look at what the costs were for 2020 with the state employee health plan to switch over into a two-part policy. That's one has an umbrella policy with Blue Cross, or whatever bid came in lowest, but Blue Cross did come in lowest. Delta Dental for the dental insurance was lowest, as well as Vision Care Direct for eye. So kind of the best case scenario there, they all came in at or below where we were at with the state healthcare plan. A whole bunch of numbers I can start throwing out. I'll put it down on paper so you can dig through them more next year, but as the commission is very well aware, over the last 5 years, we've had an average increase of 8.9% in our health insurance premiums. This year, we're able actually to reduce our premiums for next year while enhancing the benefits to the employee. Nothing major, it's just going to be lower out-of-pocket expense. But by doing that is going to allow us to open up what's called a medical expense reimbursement program. Basically, that money will be sitting in a fund that pays our health insurance. And if it's not all used, it sits in our accounts, we gain interest, and we can then continue to roll that over into the following year to help absorb cost increases or enhance benefits, etc. The policy that we have, I verified the numbers this morning with Julie Armour from FCMI. Being able to do that health insurance, the Plan A, which I believe all three of the commissioners are on, if I remember right. Anyway, it don't matter. That is 99.7% funded. And the Plan C, which is the high deductible health care plan, is almost 102% funded. The recommendation from the insurance, from FCMI, based on our previous 5-year usage, was funding at 60% would be about average what our claims were. And then, just because I was curious with JD's experience with his other agencies that he's been with, he was comfortable at 75. So as you can tell, both of those numbers were 25% above it, and we're still funding it at 100%. So unless every single employee and every one of their dependents, depending on what plan they are, max out their deductibles, we'll guarantee to have money in the bank next year. And that will be continued to build more and more each year. So very good news. No price increase, price decreases, better health insurance, better or lower out-of-pocket expense for the employee, even with the change in proportion of how the county and the employee pay that proportion. As the commission is aware, it's 89% and 11% today. Next year, it will change from 86 to 14% to the employee, and we're still be able to provide the better health insurance. It's a little bit of a smaller rate, but it's a little bit is all that matters, I guess. So that was kind of the update on the overall general budget, the health insurance as well. And I did make a mistake because I was going to bring up not necessarily the best news out of all of it, but I do want to hand this around to the commission. It's just a letter, and I know this is going to be a little abnormal to you because I usually make sure you have everything in advance prior to the meeting, but when we were looking at the fire district budget and started running the revenues as we did for the general fund, there's a couple things I wanted to point out. As the commission is aware, a portion of our general fund expenditures or our revenues are from oil and gas, about 6% of that. So it's a small portion of our overall revenues for the county. But if you consider what that same impact does for the fire district, instead of 6% of the budget like it is for the general fund, it's actually 20% of my budget within the fire district. So if I were to take that 20% reduction, I'd have to essentially make a 12% cut to the fire district, or about $72,000 overall. The proposed budget that we've been looking at within the fire district included the 1% reduction that the commission had requested each department do. However, we added that $25,000, or I had suggested that we added that $25,000 budget stabilization account in to kind of mirror the same percentages that the general fund has. As the commission aware, that budget stabilization fund is there for a reason. That is to build your unencumbered cash. It's not an expensable item, but it sits there so that way you have money budgeted to roll over to help build your fund, so that way when we become in situations where your revenues drop 20%, you have cash in the bank to be able to offset those years without increasing your mill levy rates or property taxes. So with that, I thought it would be better to bring it to the commission tonight instead of on our final night of reviewing the budget next week, to see if the commission had any initial thoughts to this before next week.
A question I have, Darren, if you were to cut the fire department by $72,000, how would that affect you the most?
Well, we would prolong future truck purchases for next year. We would not be able to fund the truck purchase that the transfer to capital would be taking place. That would be one option. I did look at the last 3 to 4 years and expenses on the truck that we have that are looking at replacing, and we've spent, it was like $23,900 just in repairs. So that truck is getting old. It's our oldest one in the fleet. Mm-hmm. That could be in jeopardy. We could reduce, drew a blank there. We could reduce other programs that we had tried to implement this year. If the commission is aware, we were going to start providing our firefighters annual physicals as kind of an incentive to being on the department. That would probably be another thing that would get cut this year as well as next year. Another option that I would also kind of help do this year would be to cut everything I can out of this budget. That means not replacing equipment, which doesn't fix the problem, it just prolongs it. So that way I can make an increased transfer out of this year's budget into next year's to help fund that fire truck purchase. So there's different things that can be done, but I just wanted to bring it to you tonight so that way you can at least give me some initial direction on what your thought was. Mm-hmm. I did look at that mill levy in relation to if we did have to increase it to be able to cover the budget of where it is with the revenue shortfalls. And if you took, with the appraiser's office, our average house in Ellis County is about $170,000. If that mill levy rate would increase, it would not increase the rates to the cities of Hayes, Ellis, and Victoria, obviously, because we're in the fire district and it's only in the unincorporated areas of the county. But on that average $170,000 home in that unincorporated area of Ellis County, it comes out to $10.58 a year, which is very little in the overall scheme of things. But I know the commission's previous thoughts on the general fund. I'm concerned about the fire district in the future years, that if we don't start taking care of it and getting that unencumbered reserve balance built up, we're going to be doing this every single time we have a oil or gas revenue decline in the county.
So by raising these .54 mils, it would account to about 90 cents a month for the homeowner.
Yes, I believe it was 88,
Yeah.
88 cents a month.
So, you know, I don't have a problem with that. I don't know what my fellow commissioners think, but I think you do a really good job out here at the Rural Fire Department. It's definitely necessary and needed. It's a public safety issue, and to keep it intact for 90 cents a month, we need to do that. Gentlemen, any questions or comments?
No, I think I would agree with that. I think that all the people in the unincorporated area know the value of the fire department, and so this .54 mils would be just to the fire district mill levy that you would need in order to recover that 72,000.
Correct. The district mill levy, which is currently set for 2021, is 3.73 mils, and that's not on the same mill levy rate as the county mill levy rate, which is 36.91. So big difference there when you're looking at the overall scheme of things. It would increase from 3.73 to 4.27 without doing any type of resolution or anything further from the commission that taking the action of raising any further with that. And I would assume with, I hate making assumptions, but when revenues go back up from oil, when the oil industry picks back up, the next budget year we'll be able to soften that back down because the lost revenues will be back, and then that mill levy can go back down. I just don't like the budgeting practice where your mill levy just goes like this all the time. It's either nice, a steady incline, but it's just not very good for budget friendly or budgets in your home to say, well, this mill levy this year, then it's this year. You know, just be a nice steady incline, and that way the households can plan for that accordingly.
Yeah, I have no problem with this. I do have a couple questions as far as the budget. I think we should make it clear. One, you know, what is our budget authority as far as the mill levy and the cap this year? I believe we could have raised about 4 mills.
Back to the general fund.
Yeah, I believe we discussed that in the previous meeting.
Preliminary estimates, if we kept the mill levy the same, which was 36.91, keeping the mill levy the same reduces our revenues by about $392,000, I believe, off the top of my head.
Okay.
And taking into account the current rate with the 1.8% increase, we could actually increase the general fund mill levy rate by 2.365, which is somewhat significant, but that would also put about $800,000, I think it was $865,000 more in the bank for reserves, for road projects, for whatever it may be. That would raise the mill levy. If we did the max, it would go from 36.91 up to 39.275.
So 2.5 mills.
2.365 mils.
Yeah, I think that should at least be noted. I think that even the people that had a contention with our sales tax should realize that, you know, they're essentially saving 2.36 mils on their property because of that sales tax revenue. It also means a balanced budget for the county. Mm-hmm. It means fully funding High Plains Mental Health, DSNWK, back to normal with EMS. You know, sometimes I think those things are lost in what we're doing here. It is saving you property tax already, and that's, I think, the only reason that we've decided that is because of the financial situation that all of our constituents are in. You know, we've decided to do that because we think it's the right thing to do right now. Is it a long-term perspective for the county? I hope. I think that keeping taxes as low as possible is a good practice in running a lean government. But if those things aren't shared with the public, they don't realize that that we have the authority to add 3 mill levies. Mm-hmm. Anyway, I just wanted to make sure we got that. We are holding the line on the mill levy this year, and that's costing us around $400,000. Anyway, you know, great news on the healthcare. a win-win for our employees, a win for the taxpayers and the budget. Great work by the Wage and Benefits Committee. Sometimes these budget shortfalls make us go and do some due diligence on things, and I think that this one has been just such a home run for our budget and for the staff as well, so.
Another good thing to point out, you brought that up about the health insurance and the benefits of it. Well, what we're paying now for the state plan, say your policy's $1,000, that's what you're paying to the state, no matter if you use it or not. With the new program, it's going to be a different split. Part of it's going to go to the umbrella Blue Cross Blue Shield policy, and part of it's staying with Ellis County. Now, if we do have a rate increase come 2022, looking at far, this time of the year next year, that, call it 5% rate increase, is not going to be over the $1,000. It's going to be over the $500 to $600. That's just that umbrella policy. It's a smaller amount, so even if it's next year 10%, it may only be a 5% increase. So that's another benefit, that we're not paying that higher increase in health insurance over to the higher amount as well.
Sure.
I think it allows our health department in the future to potentially be a benefit to our staff as well. It's somewhat self-insurance, in a small portion of what we're doing, we're self-insuring, and we're a big enough entity to do that. And I think that's, it's why, like I said, it's a win-win because of it. We're able to put some money away, and hopefully it's more money because people are healthy. But if not, it'll be there, and they're going to have better coverage, or as good a coverage at less expense in the future.
Commissioner Hazelhorst, any questions or comments?
Nope, I think it's a good idea.
Okay. Go for it.
I think JD and I will probably visit with the final budget hopefully before the packet is released on Thursday or Friday, and you'll have the complete budget for the general fund, the fire district, the solid waste fund, as well as the 5-year capital improvement plan is all complete. And we'll be in your packet next month for hopefully no further direction after that.
Okay.
The point of that, it will be for approval for the clerk's office to publish it. And then the first meeting in August will be the budget hearing. And then that then gives the clerk the right after that for the commission to approve it and be sent to the state and finalized.
Okay, sounds like a plan.
Thank
Okay.
you.
Moving on, County Administrator Report. Mr. Cox.
Mr. Chairman, I just have just a quick note about most of my time this last week has been dealing and ramping up on the CARES Act situation. I do anticipate getting out to some of the departments a little bit more in this coming week, but that's a lot of my focus right now. So that's all I have for this evening.
Okay. County Commission reports. Mr. Hazelhorst.
KAC board meeting, I believe it's Thursday of this week, so attended via Zoom. I guess we're going to go back to real meetings in August, so.
Okay, good.
So.
Commissioner Ross.
Just a couple things. As I said, I did get a set-in on that quarterly luncheon at Grow Hayes to discuss housing in Ellis County. It was very interesting. And then I did also get a set on the planning and zoning, set in on a planning and zoning commission meeting and discussed about the comp plan. It was a good meeting. I'm excited about rolling out this comp plan and the future for Ellis County from it. Those were the couple things I had going on. The other thing is I am going to be a chair for Leadership Kansas 2020 to bring people to Ellis County to see what we do. We're going to be discussing oil, education with Fort Hays State University, who just continues to be a beacon of hope for the Regents, and we're going to be bringing them into town early September, and I think all the Leadership Kansas alum are going to try and be involved in that to, like I said, we're going to teach them a little bit about water, oil, and education out here because it's things that one we struggle with, one we do very well with, and the other we do very well with. So anyway, that's all from me.
Okay. I just want to inform the people that the Board of Commissioners is being kept informed about the COVID situation. We try to be on top of it. We're always looking at the numbers. Jason's good with those. And we will make more recommendations as it warrants. And in the meantime, do as Jason says. Don't travel. Avoid large gatherings. Wash your hands. Keep your hands away from your face. And wear a mask if you deem it necessary. That's all I have. And we need an executive session.
I've got it here. I move that the Board of County Commissioners recess to executive session under the following exception to the Kansas Open Meetings Act pursuant to attorney-client privilege. The subject to be discussed during executive session is pending litigation. Open session will resume at, would be 6:40, 20 minutes.
20 minutes, okay.
Is that 15?
20 minutes in the commission room. Those persons to attend in addition to the Board of County Commissioners are the Administrator J.T. Cox and County Counsel Bill Jeter.
Second.
Have a motion and a second. All in favor say aye.
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 Motion passes 3-0. There's no action, and meeting is adjourned at 6:39.